Good morning, everyone, and welcome to the Festival of Health and Social Care. We're so excited to have you all along today for what we hope will be an informative and engaging day. We have a wide range of adult social care subjects and sessions to bring to you between now and 3 o'clock. There'll be panel sessions. We're going to start with a panel session. You see some of the speakers there down alongside me, who we're going to be bringing to the stage in a moment. We've got quickfire project briefs and sort of more in-depth demonstrations of a range of adult social care platforms that we believe will really start to drive or can help support driving self-service, transformation and improved working practices across the adult social care sector. So for those that don't know me, I am Jane Hanser from CC2I. Hello, that's me waving at the bottom of the screen. I'll be chairing the day, and I wanted to start with a quick explanation of how the festival has come together. So CC2I is a public sector co-funding and collaboration platform. And for the last 18 months, we've been running 2 social care digital innovation accelerator programs on behalf of a local government association, both of which have benefited from NHS digital match funding. In addition to that, we've brought together 2 further council-led adult social care collaborations. So the 6 projects and the 30 councils that have been involved in these are here today to talk about the process, how the collaborations worked, the resulting solution, and showcase that. The key thing here is all of these solutions have been co-funded by the councils involved. So as I say, 30 councils, in some cases healthcare and safeguarding partners as well. They co-funded them. Possibly more important, it's up for debate, but possibly more important, they also co-designed them. So they've steered the technical partners who delivered these solutions every step of the way. So specifically, we're going to hear from the first 3 SCIDIA projects that happened this year. That is the multi-agency safeguarding tracker, also known as MAST, which is a new data-driven approach to sharing safeguarding information. We're going to be hearing about hospital to home, which is a digital approach to discharge to assess. And the 3rd SCIDIA project this year was autonomy at work, which is a virtual support offering supporting people with learning disabilities around employability, mental health and well-being. From last year's SCIDIA, or the previous SCIDIA, we have Co-Liberty, which is a digital platform focused on the incoming Liberty Protection Safeguards project. And you can see there the local authorities and bodies involved. And then outside the SCIDIA, we've got the information and a demonstration and the quickfire session, of course, on Better Care Support, which is a digital animation-led approach to care and support assessments. And last but not least at all, the latest thing really off the CC2I or collaborative press is Contact and Connect. And that's using automated telephony to support a range of adult social care services. We've started with community loan equipment, reablement and 90-day reporting. So they're the projects we're going to be looking at today. I think the next slide we've got is just telling you the agenda. We're going to kick off with this morning's session with the councils talking about how and why it works. Moving in between 11 and 1 to 15-minute quickfire sessions on each of those solutions I just mentioned. Then we move into lunchtime demonstrations, so it's hopefully a time you can grab a sandwich, bowl of soup or whatever, and really see the systems working. There'll be full demonstrations of the platforms, literally how it works. You can ask questions about the back end and data and IG and all of that stuff. So the technical partners will lead you through the projects and the solutions there. And then finally, we've got an afternoon panel session with Coventry City Council, Hertfordshire County Council and the LGA. And that's specifically not looking at the challenges of digital, which we hope we will cover off this morning, but more about the opportunities of care tech to drive transformation and improve outcomes, and actually sort of look at pace and capacity to deliver some of these digital solutions into the sector alongside sort of day jobs. So that's the day, I think. So we've got a lot to get through. As with all real world and virtual world events, a couple of housekeeping points. We've got 250 registrants for today's session or today's festival, and really pleased with the numbers. Thank you all for taking the time to come along and hear what we've been doing. 70 local authorities represented in that audience as well. So really pleased that you think that some of this work that these local authorities have been progressing over the last 18 months has value to you as well. We're all about collaboration. So whilst we're on a digital system, it means we have to mute everyone just to keep the background noise to a minimum. So if you do hear a fire alarm, it is in your building. It's nowhere else. So please act on that. Because that's just me remembering a real life event. But if you have any comments, please do drop them in the chat box as you go. We'll try and bring those in. We'll try and get the speakers to answer some of them. If we can't, we'll follow up with you directly on those questions and comments. We're going to be running a couple of polls through the day as well. So really, keen to get sort of some insight, some feedback on that. The whole day is meant to be sort of flexible. So we recognise everyone's got a day job, everyone's got other commitments. So we're going to record all the sessions. We recognise people are going to be coming in and out of the day. So all of those recordings will be available on our website next week, and we'll send an email, I'm sure, to follow up. So please participate in the polls. Please tell us you're there and your comments and your thoughts in the chat box. And separately, because there's 5 separate demonstration sessions at lunchtime, you'll be getting some emails through to allow you access to those specific sessions at lunchtime, and then again at the afternoon panel. So I think I've brought together why we're here, how we're going to do it, what the festival is about. I think the key thing for me is the CC2I kind of process and how all of these collaborations and digital solutions have come together. We have a couple of golden rules. And these are them. So all of these projects that you'll hear about today fit these golden rules. So they are, and you can see them on the screen there, the projects and the digital solutions always need to address a gap in the market. So we're only looking to develop solutions where nothing exists and where it is a priority challenge to at least 20 local authorities. Obviously, no one wants to recreate the wheel, and we want to make best use of public funds. So that those two are, those two are our key. They are the #1 golden rules. And by doing that, we can ensure that resulting projects, by bringing the local authorities together, really meet local authority and partner needs. We can deliver usable, sustainable and scalable solutions. And I think, this is some stuff that we're going to hopefully, pick up on the morning session. We can reduce the burden on councils to innovate. We can move some of that sort of technical requirement and resource out of the local authority, but drive solutions at pace. Equally, I think there's a thing about bringing technical expertise in from the private sector, which is very interesting. And again, hopefully we'll pick that up in a moment. And alongside all of the digital solutions, we deliver a business case and a commercial model to ensure that scalability and other local authorities getting involved. So I think that's enough for me. I'm going to invite to the stage, or invite to unmute yourself in our virtual way of doing this, Emma Anderson. I've jumped over on myself. Emma Anderson, hold on a second. Just wanted to show you a logo fest. These are 70 odd local authorities who've been part of these projects, who've got on board with collaborations and been involved in the digital co-design. And I'm hoping the next one is me inviting everyone to the stage. Let's skip to that one. Emma Anderson, Deputy Chief Operating Officer at Sunderland Care and Support. Welcome. Give us a wave, please.
Hi.
Hi there. Marian Davison, Head of Prevention at North Lincolnshire Council.
Good morning, everybody.
Excellent. Brian Hull, Digital Programme Manager at Dorset Council.
Good morning.
Brilliant. Paul Withers, Data Protection Manager at Walsall.
Good morning.
And Julie, I can't see Julie, but I know Julie's been in and out all morning. Julie Lynn, Business Development, although I think she does way more than that at Sunderland City Council. Can we see you and hear you, Julie? Maybe. Let's hope that Julie can sort out her audio and visual as we progress. Can I start by asking all of you just to give a little bit of an introduction to the projects you've been involved with? I think we've got a spread of most of the projects here. Brian, I'm going to pick on you first because you've been involved in 2. So can you just introduce those projects and sort of why Dorset got involved?
Yeah, sure. So yeah, we joined the first Skidea for the Liberty Protection Safeguards legislation, which is due to hit us all next year. Yeah, we saw the opportunity being posted by CC2I, and just saw that that collaborative approach being one of the sort of best ways to take any new technology forward, really. Not just obviously the financial benefits of having obviously far more bang for your bucks by having 5 authorities contribute and then the match funding, it just gave us a far superior system that we could have built for the money we had to invest at the time. So yeah, we jumped on that one as soon as we saw the advert on the CC2I site, and it's gone really well. Collaborating to innovate is got to be the way to go. It's you inspire far more creativity, I think, through talking to people with a shared interest. So yeah, it went really well, and obviously there's a platform there now that deals with the DOLE's current process. But as soon as we receive that final code of practice, then there may be some minor changes to the platform before we deploy it to support the LPS. The other one, the CSA care and support assessments, again, great piece of work. The challenge of trying to get a Care Act assessment digitised was just mind-boggling, to be honest. It's difficult enough to understand if you're a professional social worker, but what we managed to achieve through the collaboration of all the partners, and obviously the professionalism of the developer that was brought on board, it's pulled together a really great platform that guides people through the assessment process, which obviously covers all 10 Care Act domains, and is supported by over 40 animations, which, as well as guiding someone through the process, also provides hints and tips of how to make themselves safer.
Brilliant. You've touched on a couple of points that I want to bring back to sort of the group in a moment, but if we carry on with introductions, thank you, Brian, for starting us off. Marian, we're going to move to you, if that's okay, and the hospital to home.
Yes. Good morning, everybody. I'm from North Lincolnshire, and we were one of the many councils that actually saw and took advantage of the development of from CC2I on the discharge to assess process. And we were really, really keen. I think there was over 200 people, 200 that applied. There was 5 councils that actually went on to work with Maldava, and there were ourselves, Southend Council, Herefordshire, Birmingham and London Borough of Sutton. And we decided that the project we wanted was the discharge to assess. And I think we'd all recognise the amount of problems and issues that actually the processes we had in place actually brought to us. There was no joined up system, no sharing of data. There was an incredible amount of paperwork. We obviously had the new discharge to a policy alongside that. You know, so a lot of congestion in the system, in challenges between the acute and community social work. You know, there was no currency of data. We didn't share any data. So we had a system that actually, you know, as COVID brought us, stepped us down from notification 2s and 5s, actually then brought in the policy. The system was clunky and congested and slow. So we obviously got involved from that point of view. Obviously, it was resource intensive, you know, no D2A oversight, and the challenges COVID caused. So we were really keen to get involved in this project because we needed one version of the truth. We needed real-time data, and we needed a responsive system, and we needed to understand the capacity and manage the demand, and we needed sign-up. So as part of being one of the 5, we match funded, as was said earlier. We then started working with Moldova in a very collaborative way. They did the technical stuff. We designed it alongside the councils with regular one-to-one meetings and discussions to ensure that the platform was actually fit for purpose. The co-design and co-funding and collaboration meant that we could afford to be part of that project, both financially and from a resource perspective. And obviously, now the system's in play, it's really bringing dividends. So yeah, that's the project that North Lincolnshire are involved in.
Brilliant, and we'll come back to some of those, you know, the business as usual and those benefits that that you're experiencing a bit later, if we can, Marian.
Yeah.
Paul, I'd like to move to you. Thank you, Marian. Paul, can we move to you and just to give us an introduction to MAST? That would be brilliant.
Yeah, sure. So the multi-agency safeguarding tracker came about through a recognised need to be able to identify things like points of contact with other safeguarding partners. So the one thing that we saw in all of the surveys and the work that's been done over the previous decades is that inability to recognise when other partners are involved at the point in time they're involved, which helps us make more informed decisions about what kind of support we can offer individuals and families or groups. So the idea was to join the Digital Accelerator, use that as a springboard to help not only co-fund, but bring everyone around the table, right people, right time, right reason. So we had a very valid reason. We saw very valid potential benefits in doing this. And it was through the CC2I and the Accelerator program that we managed to bring the expertise around the table to say how we could do it. So we're basically working on data minimization principles to break down the barriers of data sharing, and asking ourselves the questions, what's the minimum that we needed in order to have that maximum outcome? So the minimum we needed, of course, was names, dates of birth, gender, address, and date of activity. Well, the minute we started data matching with the other partners, it soon became a very big reality that we could see things like 3 fires at one household with children who were looked after that nobody knew anything about because the partners weren't sharing. So the minute somebody raised a concern and said, I've got a concern about this family, a social worker, a health employee, a police officer, a fireman could look en masse and go, oh, hang on a minute, they're not known to social care, should they be? Or they are known to social care, do we need to inform them that this has happened now? And it's that kind of work that we're doing, and we're grateful for it because it is moving at fast pace.
Absolutely. Emma, tell us a little bit about Contact and Connect, and there's a number of points within all of what you just said that we're going to pick up on again.
So I think we were interested in Contact and Connect. I think what we could see was that there are a number of reasons that we might want to keep in touch with somebody, particularly at the moment. I think we're seeing all of the pressures that are arising from hospital discharge processes, equally from the pressure that's there in the community. And there's a real difficulty around the management of human resources to be able to maintain those connections with people, but equally we can absolutely see the benefits of maintaining connections with people to be more of a proactive response and find ourselves with less crisis management. So we were really interested in the functionality of Contact and Connect and what that might do for us. Obviously, working alongside of the local authorities, we were also really interested in the use cases that individual authorities might come up with for that. I think from our perspective, we've worked with community equipment services as our first business case, our use case, because we could very much see the value of being able to recall equipment, particularly at the moment, I think with some of the supply chain pressures and all of those other things that are giving us problems in the system right now. The amazing thing for us about it is that once we started to work with that use case, we then started to see the other use cases that were coming around from other authorities, but equally identifying other functionality and potential use cases in the future for us. So I think we feel as though this is just the start of something now that we understand the value of how the system works and what it can do for us. The opportunities are endless.
Brilliant. Julie, in fact, Emma and Julie from Sunderland. Julie, are you there? I'm just going to see if you can unmute yourself. Whilst Julie's doing that, Julie's been part of 4 of our collaborations. So I was really hoping she would say, sort of why the approach to the CC2I sort of model works for Sunderland in terms of bringing in that innovation. I can't see Julie. I'm not sure. I can't see Julie. Yeah, I think we've lost her. Okay, fine. Let's talk about.
Sorry, if you can hear me.
She's there.
Excellent.
I must apologise. It just keeps going off saying there's problems.
Not a problem at all. Just for everyone, Julie is up in Sunderland. She's got lovely blonde hair. She's got a window to the side of her with the sun coming in. So if you just picture that, Julie, you've been part of 4 of our collaborations. Tell us how and why it works for Sunderland, if you would.
Yeah, I mean, it works for us because of the collaborative approach, Jane, and that opportunity to really tap into, developer and resource that we wouldn't normally have access to or the time to access really. So it gives us the opportunity not only to link with developers and private resource, but other local authorities where we can really take the learning and use of best practice elsewhere to heart and look at how we reflect on what we do and work collaboratively in that way. As you know, we've been involved in a number of different programmes with yourselves and a variety of developers. Some have panned out and worked really well. Others, we've gone so far down the line and realised actually it's not deliver what we need, or it's not quite right for us. But the opportunity is always there, and that collaboration element, you know, and the co-design element is always there. And you know, you don't have to fully go through a process and complete end to end. You can choose to go part way and see how it goes, and then review and revisit. But we've had some really good outcomes. You know, there's the Contact and Connect that Emma's referring to, another one that we're involved in at the moment, Labour Exchange. Again, that's proved to be a really valuable programme. And as Emma referred to, we start on a process and a particular programme, but actually it also opens wider opportunities for us, because the developers and yourselves are keen to work with us for design and move business cases on and bring in, you know, other programmes of work. So it's been very successful for Sunderland.
Brilliant. And I think, you know, there's a thing about that sort of, you know, as you say, sort of, you know, invest in some projects that don't go where you want them to, for instance, and you've invested just part of the money, and in most cases, to be fair, they do go where people want, because you're co-designing and steering. So, but you know, it's for part of that investment. And I think sharing that funding is something you've sort of all touched on. I think it's fair to say that most of these projects wouldn't have got off the ground inside a local authority. But you know, I think definitely the Skidea projects have all been 120, 180, you know, it's between 128, 180,000 pounds of public funding invested, and that's just not possible, is it? I don't know who want to take the floor there on talking about that sort of percentage investment and funding to be involved.
Jane, I'll come in. From our perspective, absolutely not. I think, you know, the initial investment for certainly some of the programmes is real value for money. We get to see the business case, we get to see the offer, and we can share that with our directors and exec directors and chief, and they can see the opportunity in that core design. There's also the commercials that are attached to a variety of programmes and how, you know, that benefits local authorities. So it really does make a difference in terms of use of resource. And I think, as somebody referenced earlier, you know, it's not entire resource coming from the local authority, because you've got partners in a collaborative approach. So it alleviates that as well, because you're quite right, we've all got a day job to do on top of it.
Yeah. Brian, you had some interesting thoughts, because it wasn't just about IT from your perspective, was it? It was also about business analysts when we spoke last week.
Yeah, obviously there's huge pressure across the whole system at the moment, and I suppose that one of the ways I looked at it was a lot of these projects are on the side of your desk. By working on the Skideas and with CC2I, that added 2 foot onto the side of my desk to allow me to get extra projects in. And but yeah, things that would never have happened. As I say, it was a massive challenge to do to get the Care Act assessment digitised, and yeah, something that benefited from that collaboration approach, making sure we'd covered all the areas that we needed to cover, making sure the language was appropriate, all very strength-based, and a very agile project as well. So it's worked really well.
That one was interesting, wasn't it? Because we were just bringing it together just as the first lockdown hit, and I think it was yourselves and Oxfordshire who suddenly went, okay, we recognise that face-to-face services are just going to be completely changed, not knowing how long that would actually last for. And you jumped in, didn't you? And that got going straight away. So yeah, it's interesting sort of what drives innovation and the accelerator process. Marian, I saw you nodding quite a lot about hospital to home, and I know that hospital to home wouldn't have got off the ground without that central funding as well.
No, that's right. I think the central funding and the match funding from the 5 authorities allowed us to be involved, like Julie said, right at the concept, at the beginning. So actually, when we were looking at it, it was a real collaboration, you know, a collaboration with Moldova that actually took forward the platform on and listened to us. So we worked together, and I think that was easy to demonstrate in a business case to actually get the funding, but allowed us to free the resources up to actually attend the meetings and the regular input, because obviously it didn't just involve us. We had our governance, and we had our IT people that came along to look at the system and how it was going to work. And I think right at that beginning, as the discharge to assess process came on board, and actually in August, you know, when it was became a policy, it was easy to see how the discharge to assess system sat alongside it and actually supported it. So it was a real catalyst at the same point that actually we were working to develop the system, and we could see how the flow would work. So the timing, despite COVID, I think COVID gave us that richness to show us what the system could give us. So we could actually, it was tangible. And I think, like Julie said, that really gave us the incentive to work closely. But I think it's the collaboration that was key, you know, because they listened, and there was 5 councils, and they adapted and to meet the need to ensure that actually, you know, collectively we all knew what the outcome was, and that was the end result of knowing where people were on that pathway. Actually, it's such a simple cloud-based system that allows it a touch of a button to get that. And I think that was the very beginning was really important key for North Lincolnshire.
Yeah, yeah. And I think that's the same for LPS, you know, although the policy has been delayed or whatever, you know, back in the first schedule, you know, having that sort of greenfield, new legislation, everyone's got to do something differently. Yeah. So, okay, that's a great point at which that, you know, to start looking at a digital solution. I mean, I guess if we move to Paul, you know, and Paul and Emma and Julie, really, the technologies that MAST and Contact and Connect use aren't really they're not greenfield, they're not cutting edge. You know, they're good, solid, proven technologies, aren't they? But they're just being brought together in a new way. And particularly, I think in the West Midlands, Paul, you know, it's not just about the technology; it's about bringing together the partnership and bringing together the information governance to make all of this happen.
Yeah. So for the technology part, we relied heavily on the expertise from policy and practice and Devon and the team, because they've done this work previously. And as you stated at the very beginning, it's not about reinventing the wheel. It's about potentially redesigning it to go faster, if you like, for want of better words. So why reinvent the wheel? There's a really good model there. Let's jump on the back of that expertise and save ourselves additional resource and efficiency costs in trying to do something else, when what we're trying to do is achieve the same goal. So for us, the aspect of it was we need to data match, we need to be able to cross-reference, we need to be able to validate, and we need to ensure it's accurate, timely, and available on a need-to-know basis. That's nothing different from what a system should be if we're applying privacy by design principles or data protection principles or governance principles into those builds. So yes, PIP, getting them on board, excellent. The partnership and the governance issues, that's all about having a plan that is defined and explicit. What is it you want to achieve? How do you expect to achieve it? Can you do that lawfully? If not, ask, is there another way of doing it that will achieve it? Don't accept no or a barrier. Data protection should not be a barrier. It should be an enabler. So it should turn around and say, okay, you want to do it this way? Well, that's not quite right. Get to the bottom of why you want to do it. Why you want to do it will give you that lawful basis for doing it. Then make sure you get the buy-in from your stakeholders. Get the right people around the table, right time, right place. And if everyone agrees the concept, you can fly. You literally can. Yeah. There's no point in getting in a car when you can get in a linear jet or something. Let's all get a jet and just do it that way.
I mean, I think, you know, MAST definitely is one of those projects that it needed to be taken out, didn't it? It needed it needed those partners to come together separately, but you know, you probably hear from the passion in Paul's voice. You know, he's driven all of the information governance, which essentially is what MAS sits on, and that project particularly is you know, it's a fabulous solution, but the fact that we've got the information governance that can be reshared for other areas, local authorities, you know, they're brilliant deliverables. And I think, you know, even in Contact and Connect, Emma, we've sort of recognised that actually maybe, you know, we needed IG, and Marian, you mentioned you need IG to be involved. You need, you know, those, you know, all the DPIs, you know, you need all the documentation, you need everything in place before you can progress with these systems. But again, we hope that, you know, bringing partners together, you know, some of that burden shared. I know on Hospital to Home, Birmingham did a lot of that work, and North Lincolnshire did a lot of that work, and the others brought other stuff to the table. So that's sort of was an interesting dynamic, how you know, different partners bring different stuff to the table. Emma, yours has been slightly different because it was kind of an open brief, and Sunderland chose community loan equipment to see whether automated telephony could support, and Gateshead chose reablement, and Kirklees have chosen something off in housing. So we're still to see how that comes out. But you know, even working alone, I think you recognise the value that those other councils brought, and sort of the pace, didn't you?
Absolutely, yeah. I think it was really useful to understand how everybody's concepts were kind of developing. But one of the key things for us, I think, was about, you know, the collaboration with the project team itself, and the process that we went through. So obviously, you know, we had the idea, and the idea on the surface sounds very straightforward, but actually the piece of work that we then did around the scripting to make sure that, you know, what the telephony app was actually asking somebody is exactly what the question is that the person needs to hear. You know, even in something as simple as recalling equipment, we don't always realise as professionals that actually we're using a bit of jargon. And when we first started to think through some of that scripting and then listen to some of it back and hear what it sounded like, you could hear it from, you know, the ears of somebody who isn't working in the business and does need to understand in real plain terms what exactly is it that I'm being asked to do. So that collaborative process, I think, where, you know, we iterated the script that was going to be in that app so that we understood exactly what it was going to sound like to the end user was really, really helpful. Having the right people around the table and the timing of the conversations that we had, it was really rapid. So, you know, we were all on board and felt as though we were achieving the objective really quite quickly, and that's really exciting to be involved in. So, you know, that whole iterative process was absolutely invaluable.
Yeah. I recognise that we've got a poll live, and I haven't told people about it, so I'm just going to break in if that's all right, and just say, I hope that you're finding the conversation interesting. I've seen some stuff come into the chat, but I've also seen some colleagues sort of answering some questions. If you've got anything to bring to the speakers about the different projects, please drop that in now. But we've got a poll here, which is around, I guess, you know, what are your local challenges of driving forward innovation? And I think, you know, we've touched on a lot of them, and hopefully what the CC2I model tries to address. But really keen to get some feedback from people on the session. Is it around budget? Is there just not enough money to go around to do more innovation? Is it around organisational appetite? I know often takes a lot of conversations and time to get these type of projects off the ground. Is it around, you know, particularly around collaboration? Is it sort of the legal framework or procurement challenges? I know that we often talk to procurement colleagues about, you know, how and why this is a different way of doing things. Going back to, you know, I think the points that everyone references, the dedicated IT support. You know, a lot of these projects came together around, you know, external funding. You know, the SCDIA is part of the SCDIP, and often that SCDIP funding goes to one local authority. And they do work, and you know, it's hard to understand what's going on there, but it's also hard to apply for those funding opportunities. So we know that that's often a barrier to people getting involved in transformation programs. Transformation just internally, or there's just too much going on. It's probably isn't it just the last maybe? But if you could submit your vote, and we can hopefully you can see that poll on the right hand side of your screen there. But is there anything anyone would like to pick up on from that poll, or you know, that's been particularly pertinent to you?
Yeah, Jane,
Right?
I think there's one thing missing from the poll, unfortunately. There's
Okay.
enough response answers there to be able to gauge the general feel, but I think one of the things that is missing inherently or historically is where to go with innovations. Where do you go with your ideas? And if the organisation doesn't have a panel or a body or somebody that can sit there and say, great idea, what's the benefit, how can we achieve this? And you need that collaborative approach, and you need to be able to take it through the appropriate chains of command, for want of better words, so that you get that buy-in and you have that support from the organisation.
Yep.
You know my backstory. MAST has been an idea of mine for 12 years or 14 years, since CPIS started, and we built MASH in Birmingham. When I said we're missing the point here, what we're talking about here is people that are already known to the system. Why are we not looking at individuals that are not known and trying to identify what's gone wrong and how can we help them? Now, I was really passionate about that at the time, but at the time I couldn't get a seat with the right people to talk about the idea. And it wasn't until 14 years later, when we had multiple requests coming from the police for data sharing, that the Director of Public Health said to me, can we come up with an idea? And I went, oh, hang on a minute, I've got one. It's 14 years old, but now's the time to bring it out the closet, because now I've got the right people to listen to it.
Yeah.
So I think as organisations, we need to do more to listen to innovative ideas. The people working on the front line are often those best placed to tell us where we can potentially make something more efficient, more effective, improve that service delivery aspect, because that's what we're trying to achieve at the end of the day, I think.
Absolutely. Brian, I can see you're nodding as well. Agreement there? Oh,
yeah, sorry, couldn't get off mute. Yeah, and yeah, completely. I'm just looking at the poll results coming in. Transformation programs going on, going across local authorities up and down the country, which is all linked back to the budget at the end of the day. Yep. But yeah, the capacity to actually focus on any of these individual areas, I just don't think would be possible without something like this. So the resilience that it brings to the project. If we are having some localized problems at any one time, that might count us out of a workshop, but we know that 4 other authorities are still contributing, and the project doesn't stop; it keeps moving on. So, just built in that resilience and agility, flexibility into the arena.
And I think picking up on your point, Paul, around having the right ears in the organisation has been really, really key for MAST in particular. You've got the backing of your Director of Public Health. And probably they're hard conversations to have to get some of these projects off the ground, aren't they? So unless you've got that kind of buy-in, then maybe it just can't happen. Are you having a sandwich there? Is that your breakfast? All right.
As you know, I'm on holiday, so I am treating myself to a chocolate pancake.
Oh, good. Oh, very good. Well, you're actually making my stomach rumble. Let me go. If there's anyone else who hasn't voted in the poll, please do vote in the poll. I think some of the questions that are coming in from people are around integration, around the systems, and just obviously after this session at 11 o'clock, we're going to kick off with those, quick fire sessions from the technical providers, followed by the longer lunchtime sessions, which will be a proper showing of. In the case of Contact Connect, you'll be listening to the calls and you'll be seeing the business case and so on. And for the other platforms, showing the platforms and how people run through it all. Marian and Emma, or Julie, in fact, if we can, I keep forgetting you there, Julie, sorry, because I can't see you. Julie, Marian, Emma. For Brian and Paul, these collaborations have delivered a solution, and it's interesting because this afternoon's session, and from both of what you just said, actually, it's around capacity to actually embed that solution into business as usual, into the local authorities. And this afternoon's session will look at trying to tackle that capacity, trying to understand how councils and maybe collaboratives can move forward to find more resource to help the implementation of these systems. But Marian and Emma, you know, your systems have been deployed now. Marian, if I go to you first, Hospital to Home went live, I'm saying off the top of my head, in February, but tell us what happened.
Yeah, Hospital to Home went live in February, as you say. And I think what we had to do as a system, we had to do short snaps of educational video with key people. So what we did was we took the system and demonstrated it to our partners, in health, the workforce that were actually going to use it, you know, because we were aware it was a new system. And at the time, people were tired. You know, we were coming into a third wave. It was a new innovation, a new piece of work that people thought we were going to have to learn and retrain. Actually, it's simple. It is a real simple system. And I think that gave it real brownie points with the staff, because when staff could see that actually the system was so simple in the way it's presented, and now you put your information into it, although at the minute we haven't got interoperability, that is the next phase with the acute from the wards, but actually we've got data input in it, putting it on the system. Once it's on the system, it's so easy. So once we went out and did those sessions with staff in the weeks leading up to it, involved our health partners and our community health partners, because they can view it, because it's a cloud-based system. So we got them on board by doing those testing out of the system. And I think, to be fair, a lot of them were involved in the collaboration when we were testing the system, but we actually showcased it. And I think that really worked well with the, you know, doing those workshops so people could see it. And I think then when people actually saw how it was going to pay dividends to them, and I think it is a practical thing, because staff want to see that it isn't actually giving them yet another piece of work or another piece of data input. They could then see that actually it reduced the amount of paperwork, it reduced the amount of lists going around the system of people that were in the system for discharge. It reduced the amount of congestion in the system. And by saying that, that is around the telephone calls, the conversations, you know, and people don't see them at the time as an output. But as soon as the system started working, and as a senior manager, I can touch a button and I can tell you how many people are ready for discharge. I can tell you the pathways. I can do that on a Friday night when I see, you know, health will say we've got 4 people waiting. I do that from my desk with no phone call. I can see the system. So when staff saw the benefits, that's when you get real uptake, and that's when we had real buy-in. And the system has never posed any problems, as in nobody not being able to do it, because it's that simple a system. So yeah, it's the investment at the beginning to show and demonstrate and converse with people, i.e. staff, how that's going to be implemented. And I think that gave us dividends, because now buy-in is there, you know, health partners are using it. We are now moving on to interoperability, and you know, it's the time saved in administrative work. Yeah. So it has really been a benefit for North Lincolnshire.
Brilliant. And I think it's only until you start using it that all of those benefits start to come out, isn't it?
We're 6 months down the line now, and we're starting to see the benefits. You know, our length of stay is reduced along with the policy. You know, the system partners are actually working better together because communication's clearer. The amount of administrative work, the lists, you know, they're not there. We don't have meetings talking about lists. We go on the system, we check it out. There is a little bit of creep going on in some areas where I think people default back to type of what we've always done. And I think, but we're 6 months down the line and we really need to embed the system and develop it as we go. But yes, I think 6 months and we're starting to see those benefits greatly.
And I think that's sort of the benefit as well of bringing in a technical partner who maybe who just knows technology and knows user interface and knows how to design a system. And you guys know what the solution needs to do in terms of the actual business process. So the combination of the two, I think in all of the cases are usable, you know, really easy to use, you know, valuable or relevant systems.
Yes, I think it took us altogether from last July to implement it to be ready to go in February. I think we all know as local authority, we would still be designing it and testing it out, whereas having that technical partner to bring that to the table and really understand that, I think that's where you go from your collaboration, listening and communication. That system was up and ready in January, where we were just starting to, make sure that staff were really well aware of it, and we included it. But interestingly, that if we didn't have that partner, I don't think we'd be as far on as we are.
Absolutely, yeah. And Emma, interesting to go to talk about the engagement with your contact centre staff, who've done a lot of work and who do the calls, the follow-up calls, following the automated calls, don't they?
Yes, absolutely. So I think there were, in terms of our implementation phase, there were a few things for us. One was about making sure that the data was uploaded in the first instance, so we knew how to put it in, and also making sure that we knew how to get it out. And then obviously the follow-up calls that happen once we've received the results from the calls themselves. So we have a transfer hub in the community that supports people in out-of-hospital pathways and who might be having difficulties in the community. And we identified that team as the team that we wanted to make those follow-up calls. So we involved them in the testing process so that they could hear as a user, what would it sound like to take that call. So they understood, the user experience. And then, that kind of just brought it to life for people, really. And as Marian says, when you involve people and they understand exactly what the benefits are and how it feels to be a user, it's just really helpful. From there, I think what we've then found is that the focus post-implementation hasn't so much been on the technology itself, but actually been about the outcomes of the conversations that we are having with people. So on the surface, it sounded very straightforward. We thought we were communicating with people to say, do you still need your equipment, or would you like to send it back to us? But the reality is the conversations that we're actually having with people are sometimes that straightforward, but sometimes they're very much more complex. So actually they're about, people's needs having changed, particularly in and out of hospital pathway, where they may have seemed stable, at the point of hospital discharge and haven't received that piece of equipment, but very quickly actually things start to change. They haven't necessarily reached out to someone, aren't sure who to talk to when things are changing. We're having those conversations now as a result of actually just making contact with somebody about a piece of equipment. So the benefit for us has been much broader than we ever anticipated it to be. And actually, if I think about resources and the resources that it's taken, to implement the app, well, we probably would have been having these conversations with customers anyway, but we would have been having them in a crisis. We're actually now having them in a much more proactive way, which enables you to get much more, or better use from the resources that you've got. And I think because we've put it with the team that we put it with, they feel as though they are much more coordinating and navigating people's journeys. It's not just about the piece of equipment, it's about all of the other services that they can connect that person to. They're really well placed to do that, and we can prevent some of those other crises that might occur arising. So, we had not anticipated that as being an outcome of the app at all, but it's absolutely where we find ourselves. And I think, having listened to some of Marian's experience, it's kind of where we are as well, and we're all sort of in that same space. We've just come at it from a slightly different angle, but the benefits, are very similar. So once we've seen that, we're now starting to have ideas about other places, in the service that actually we think we can deploy the same technology for the same benefits. Initially, I think there was a bit of a concern that were we replacing human contact with an app, and it's about the blend. It's about the blend of the technology with the person that you then have the conversation with. But those conversations are proportionate, so that's just been really helpful for us.
Yeah, and everyone wants to move to the preventative space, don't they? And Paul, that's very much what MAST is trying to do as well, isn't it? It's very much trying to move everyone from crisis up the scale or up the road to sort of prevention. You're on mute, but have you got anything just to add to what Emma's been saying around using digital for prevention?
I think it's about not just realizing the benefits of your initial goal or idea, but also when you start to discover those wider benefits, how that changes the morale of your resources and your staffing and your individuals, because now they feel valued as well, as if they're not just adding value, but they're actually doing something more than just handing out a piece of equipment or organizing that. They're actually engaging now and starting to have conversations. And yes, it's one of those side effects that we often forget. If we're going to improve the use of technology and digitalization and the more wider variance of effective, appropriate data sharing to achieve other goals, what are the other potential benefits? And I remember, 15, 18 years ago, when we were doing Microsoft Office specialist training, because when I was in health, it was a freebie for NHS staff that we could get this training, and people were so hesitant. The barriers went up, and I've got to do this now, or I can do this. Yes, you can, yeah, but I've got to do it in my own time. Yeah, it's for your own benefit. It's a free course. If you want to do it, go away and do it at weekends or at the evenings. But the outcomes, once we start to see the outcomes, that the speed and efficiency of people to be able to do silly things like mail merge or record keeping or this or that, because they'd been given more training in the functionality of the equipment. I think as organizations, we often sit here and go, this piece of kit's going to be fantastic, or this functionality will do so much for us. But we forget to bring everyone along on the journey. And if you bring everyone along on the journey, then of course you're going to get added benefits.
Yeah, and often it's, the building the system is quite straightforward. It's building some, putting together some code and making sure it does what it's supposed to be doing. But absolutely, it's the hearts and mind. And definitely on the MAST project, there's been a bit of pushback from social workers around, is this another system? Are you trying to replace my decision making? And none of that's the case. There's no double entry, and it's all just informing decisions and trying to improve.
And fear. Fear as well. And I'm sure Emma's had the same thing, that when all of a sudden you start to realize you can actually do this bit as well and that bit as well, some of the first questions we ask ourselves is, are my resources now going to be able to cope? Are they going to have more pressure? If we develop things for safeguarding purposes, are we suddenly going to get more safeguarding referrals? Are we suddenly going to get more pressure on already stretched resources? And it's about flipping that coin and understanding that unless you try, you won't be able to measure what the efficiencies and values are. And once you can measure them, that's a weapon. That's you weaponizing information to be able to say, okay, now I understand I do need more resources, or I need more budget, or I need more of this, or I need less of that, because you've got the evidence to make informed decisions. Unless we try, we'll never know, unfortunately.
Absolutely. And I guess the demand on resources, Brian, is something that care and support assessments particularly is challenging. The number of assessments that are coming through councils and the reviews. So if you can drive people on a really sort of usable, straightforward system to self-assess, then that's hopefully going to be taking some away some of that pressure on the resource.
Yeah, absolutely. Anything we can do to facilitate and to, I suppose, translate that technical into the business benefit side. So as Paul was saying, all the provider developers that we were involved with at Looking Local, before we'd even started the conversation around integration, automation, single sign-on, all of the things that are going to provide those benefits that are pretty much, or should be, on scene to the business, really. They should just see the benefits. But before we'd even got into the conversations, Looking Local had already started conversations with case management system providers and started looking at the potential for integration of that assessment data into your core case management systems. They were open to conversations around the single sign-on aspects, and if we can do all of that without having to sort of worry the business with the technicalities, we can just say, okay, the system can do this, this, and this for you. It makes the sales pitch, for want of a better words, far easier, because they don't have to worry about the technology.
Yeah.
I don't obviously. Paul, using anecdotes, going back 20 years, I wrote a paper on technophobia, eliminating technophobia, and a lot of the research went into that. It was all around fear and embarrassment of not understanding the technology.
Yeah.
You don't have to understand the technology anymore. There's so many low-code approaches to developing integrations, automations, that and through the sort of collaboration of this type of project, if you haven't got the skills in your own organisation or the knowledge in your own organisation to understand that, somebody is going to, and somebody will step up and add that to the project. It becomes a much richer platform in the end.
Yeah. So definitely, you know, on a number of our projects, we've sort of created collaborative training materials that all partners could use. But, you know, we've had a couple of comments in around, you know, the introduction of a system to users with no experience. We can expect all the benefits should be achieved straight away, but that's often not the case. And actually, you know, we need to take time to embed systems. We need to project manage that, you know, the embedding of implementation of systems, and as you say, Paul, you know, get the hearts and minds and the right people around the table to understand that it's really simple to use, and hopefully it's going to bring benefits and lighten the load. We've had a comment in from Matthew as well around budget. Budget can be a barrier unless there's evidence that points to potential savings, allowing for better spending as a result of innovation. Absolutely. I mean, that's exactly what all of the partners do all the way along, and that's pretty much the role of CC2I. Actually, we work and have conversations with the local authorities around what the business case is, or what, you know, what the business before we start is, and where the savings will be, and then how we start to evidence through deployment and through ongoing metrics, you know, the benefit of that. And as Emma said, you know, there's often a lot of surprising benefits, but also, you know, cashable hard savings, and we build that into a business case that we then sort of share with others based on their numbers and so on. So I recognise we're 3 minutes to 11, and I wanted to thank you all very much. I think we've had a really interesting conversation. I hope everyone who's listening understands the approach and the benefits and you know, how it kind of works. I wondered if any of you had any ideas of, you know, new collaborations that we should look at in 2020 just before we go. And again, if you've got ideas, if you're listening to this, ideas of collaborations that might be valuable in your authority, just drop them into the chat. Emma, I know you're looking at Contact to Connect for other areas. Now that Julie's not here anymore, I'm going to ask you.
Yeah, we absolutely are. I think on a daily basis, Jane, we'll probably have a new idea about where we think we can use this. So just yesterday, I was talking to our wheelchair service, who are really keen to start thinking about proactive review and how we could involve, you know, the use of the app in that. We're also looking at things like our Pathway Zero patients leaving hospital. I think we've got a number of potential areas that we're really keen to look at this technology with.
Brilliant. Marian, if you could start a new collaboration, where would that sit?
I think that would be over the intermediate care system, and how we then follow people as a step down into the community and their onward going journey. And I think that's where we would really be keen to focus next. Although we see that we can expand the home from hospital, because, you know, we can even get transport on it, so we can see when people arrive at the destination, as well as at the beginning of the journey, when we can get our acute colleagues actually inputting on it and moving away from Web V2 systems and actually get the interoperability. So, and I think, like Emma, every single day I'm really interested in the MAST, the safeguarding stuff, and that's given me ideas of, oh, I could nick that idea and get that over here, because I think the data sharing is just a fantastic tool that, you know, it isn't a barrier. I totally agree with Brian. It is something that we should be really pushing and enforcing in social care, that data sharing. So yeah, lots of ideas.
Brilliant. And I know that we're progressing something on that interoperability and integration piece, so that will be picked up a bit later. Brian, if in 10 seconds, have you got an idea for a project that we could go, or, you know, new policy coming in?
We've been looking at the challenges around place-based provision of care. So looking at the voluntary community sector and engaging with them, engaging better with our partners, making sure we get the right solutions in place at the right price that can quite often be provided at that micro level.
Okay, interesting. Paul, you've got no time, so nothing to add. Perfect. That's a surprise. Usually you got lots to add. Paul, yeah. I'm sorry, I've got to cut you at, it's 11 o'clock. Thank you all so much. I think you've really brought it to life. And now as we move into those 15-minute sessions, people understand what you guys have done, you know, the input that you've done, and you've steered the technical partners who are going to be doing the quickfire sessions now. I'm going to say goodbye to you all. It's been lovely to see you, as always. Please, if you're not a speaker, stay on. We've got the 6 sessions now coming up. Do add your questions into the chat box. All of these, as I said before, are recorded. We've come to some questions, but we might move some of the questions into the lunchtime demo sessions if we're running against time. We're going to kick off with MAST. I'm wondering if my system supervisor